What will help look like? There are three main ways to treat depression: with social support and activities, with medical approaches including medication, and with psychological therapies. Social support and activities should always be part of the treatment. Medication and psychological therapies can be used together or individually alongside social support and activities. A depressed older person can access more than one approach, and a combination can work better than any one alone. Treatment should always be tailored to the individual person. If an older person visits their GP, they'll be asked about their current worries or concerns, when they started and how they affect them. They'll also ask about suicidal thoughts, thoughts of self-harm or thoughts of hurting other people. Sometimes depression can have a physical cause, and the GP may conduct a physical examination or arrange blood tests to look for physical causes. The GP may assess the older person's cognition. This is to screen for cognitive impairment which may need further investigation. They may use a tool to assess the severity of depression. The most common tool used is called the PHQ-9, and it consists of 9 questions that ask about the symptoms of depression, including a question about self-harm. The GP might suggest antidepressants to help with the symptoms of depression. They may also suggest psychological therapy and social support. The NHS Psychological Therapy Service is called NHS Talking Therapies. Older people can refer themselves to this service directly without needing a GP appointment. A first appointment will usually also involve completing the PHQ-9. Sometimes this will be through a telephone screening appointment. Following this, an extended assessment will be arranged with a trained therapist. The therapist will support the older person to manage their problems and agree goals for therapy. Depression in an older person may be triggered by social issues such as poor housing or loneliness. Social prescribing teams work in or with general practices and help older people meet many different types of non-clinical need. This could be support and advice around debt, unemployment, housing or mobility problems, or tackling loneliness by building social connections through joining local community groups. If an older person is experiencing psychotic or suicidal thoughts, they'll need urgent help from the mental health crisis team. A crisis team worker can be a nurse, occupational therapist, doctor or advanced practitioner, and they can visit an older person at home. The crisis team support an older person to stay at home safely when they are severely depressed. Very occasionally, someone may be too ill to stay at home while they are treated and recover, and the crisis team will support that person to gain admission to hospital. They'll also support them on discharge.